Oral complications are common in patients who are receiving radiation therapy for head and neck cancer. This video will provide information on the most common complications that can occur and some tips to help prevent them. Xerostomia, or dry mouth, is a main side effect that causes you to produce less saliva or spit. You will also notice that saliva becomes thicker and stickier depending on how much radiation was delivered to your salivary glands. Your risk of dry mouth will depend on where your cancer is located. Your radiation oncologist will talk to you about this. If you experience dry mouth after radiation therapy, make sure you get enough fluids. It may be helpful to sip water throughout the day. There are also several over-the-counter products that can help ease the dryness. Your saliva may continue to improve for months after you complete radiation treatment. Radiation caries, or tooth decay, is caused by dry mouth brought on by radiation treatment. Radiation caries occur because you are producing less saliva. This means there is less saliva available to neutralize the bacteria that cause tooth decay and cavities, and less saliva to strengthen tooth enamel. Radiation caries are caused by damage to the salivary glands during radiation, not by damage to the tooth itself. This means that you can have radiation caries if your salivary glands have received radiation, even if your teeth did not. One of the most severe side effects of radiation therapy is osteonecrosis, or bone death. Radiation can destroy some of the small blood vessels that carry oxygen and nutrients within the bone. This keeps the bone from being able to heal. The bone may become infected and painful. In some cases, the patient can even lose part of the jaw. While this side effect is rare, it can be quite serious. To reduce the risk of osteonecrosis, be careful before having any invasive dental procedures after radiation. If you are thinking about having dental surgery, let your dentist know that you have received radiation treatments. If you have to have a tooth pulled after you have had radiation, hyperbaric oxygen therapy may lower the risk of osteonecrosis. Hyperbaric oxygen therapy floods the bone with oxygen in a pressure chamber. Your dentist may contact your radiation oncologist to learn how much radiation you received in the jaw. This will help the dentist weigh the risks of a particular dental procedure and determine if preventive measures are needed. If you wear an appliance such as dentures, see your dentist for adjustments on a regular basis. This will help prevent tissue irritation that may lead to tissue death. Other complications that may develop after you have had radiation treatment for head and neck cancer include infection, changes in the way food tastes, trouble opening your mouth, swelling and ulcers in your gums, and younger patients may have problems with tooth development. Because you are at a greater risk for tooth decay after radiation treatment, your oral hygiene routine is even more important. You will need to practice preventive dental care. Here are some of the steps you should take. Brush your teeth at least 2 times a day with a soft toothbrush. Floss your teeth at least once a day. See your dentist on a regular basis. Have your teeth cleaned by a hygienist every 3 months. This will help keep your teeth clean and will find cavities or other problems early. Have a fluoride treatment every day. You will receive fluoride trays that are custom made to fit your teeth. You will be given instructions on how to use the tray. It takes only 5 minutes. If your mouth gets dry, try these steps. Sip water throughout the day. Suck on ice chips or sugar-free candy. Chew sugar-free gum. And/or use a saliva substitute spray or gel, or a saliva stimulant if your doctor prescribes one. If you have any questions, please ask one of your caregivers. Thank you for choosing Cleveland Clinic for your care.